Well, today we saw hundreds of Oklahomans gathering to give a strong message to lawmakers and to the governor that the time to expand health coverage is now, that we have waited for the better part of a decade while 37 other states have brought their federal dollars back into their states to expand coverage to make sure that people can see a doctor, fill a prescription, get the care they need. Oklahoma has waited long enough.
And I think the legislature has changed. It's changed tremendously in the last year. And so I think the time is right when, and let's use it to our advantage, the time is right where, doing the right thing for our people, doing the right thing for our hospital has meshed with political expediency.
Until this year, there was a firm refusal to even have a conversation about expanding health care. And this year, we're finally seeing that change. I think in part that recognizes that the Affordable Care Act is here to stay. Efforts to overturn it have failed in Congress, but also legislators know that an initiative petition has been filed, that if they can't get this done, that the voters will make the decision. The initiative petition would simply expand Medicaid up to 133% of the poverty level. Many of the Republican lawmakers and the governor who are in conversations are looking at an alternative that might use commercial plans that may have other provisions. We are hopeful that any plan that gets developed makes sure that the expansion population has access to comprehensive coverage, that we don't put unnecessary red tape and restrictions in their way.
I hold some sort of hope with anything that they do, but I am a bit taken aback by the governor's position on it. And this morning he had stated his position that he wasn't going to support it. But I hope that they're able to change his mind. There's a deep crisis here in the state, especially in rural areas where they don't have health coverage, I should say. So, I think that a lot of people would be open and down for pushing that initiative.
When a rural hospital closes, good-paying jobs leave. Physicians and other healthcare providers go with them. Without a hospital, the community struggles to bring in new businesses and additional jobs.
The closure of rural hospitals affects everyone, and it has an economic effect. It has a ripple effect. The hospitals employ people, so it affects jobs. It affects jobs because people who are not healthy cannot work. And if they cannot work, they cannot contribute to the tax base. It just makes economic sense. And people who are sick are going to get coverage, health care coverage, but we're all going to pay for it anyway because they have no insurance. I mean, it's ridiculous. It's a win-win for everyone.